Good morning, friends. It gives me great pleasure to be part of this 27th AOFOG Congress, and I must say big thanks to our AOFOG President, Professor Kazunori Uchiai. A big thanks to Chairperson of the Indonesian Obgyn Society, Hari Kusuma Janawatro, and also to the Congress Chairman, Professor Endon Heziantoro. Friends, we all understood that we need to learn a lot as far as this Congress is concerned, because we know that it's very well said by Atul Gawande that our great struggle in medicine these days is not just with ignorance and uncertainty, it's also with complexity. How much you have to make sure you have in your head and think about. There are thousands of ways things can go wrong. And that's what the COVID taught us in last couple of years. We understood so many problems associated with this COVID-19, and we also saw its evolution, which we are going to see in coming 15 minutes very quickly and can take it further. This ground-like virus threatened not only the general public, but more so the health professionals, including the doctors, nurses, paramedicals, and lab technicians, because we were knowing that this virus was not sparing anyone. And newer variants started in coming in our scenario. Especially Omicron threatened us a lot. Then came the African variant. So this rapid spread of new variant offers clues to how SARS-CoV-2 is adapting and how the pandemic will play out over the next several months, and it's never end now. What we need to do is to see this evolution very carefully. The first pandemic which entire world faced, we saw that the protocols were changing every day in this pandemic. Whatever available information, protocols which we created ourselves to treat our patients, but the hospital practices and resources were very in various countries. But we know that basic principles are same and are applicable to all. We understood to take the universal precautions for every patient entering the facility, assuming she is carrying a COVID disease. Now, question comes, what does it mean, the mutation or the changes? We know that it changes a little bit to adopt. And these mutations, when occur, we refer them as a variant of the original virus. As the more viruses circulate, the more they may change. And these changes occasionally result in virus variant that is better adapted to the environment compared to the original virus, what we call as a virus evolution. Question comes, why I'm so concerned about it? Because it's normal for the viruses to change, but we know that we need to monitor it carefully because these changes can occur in the genetic material. They may affect the virus properties, especially its transmission and severity can change. And that's why WHO and its international network of experts monitor these changes very carefully. They report any modifications or interventions accordingly to the countries, to the individuals, so that they can also adopt to overcome this particular viral attack. Now, about the animals and its implication, we know that again various groups like WHO, Food and Agriculture Organization, and the World Organization for Animal Health, they found that there is a definite transmission occurring between animals and humans. But further research is needed to better understand whether these variants will cause sustained transmission among humans and could have a negative impact on the countermeasures, especially the vaccines on which we rely. Now, where this virus came from, there were two hypotheses. We know that it was infected animal or man-made in the laboratory. Of course, there's not enough evidence to support either argument, but we know that in 2019, this came from the Wuhan, China's open-air wet markets, and that's how the animal involvement was thought about a lot. But this virus is not new. Since 1965, this human coronavirus has been identified by scientists. First, it caused a common cold, and later that decade, researchers found a group of similar human and animal viruses, and then they were named by its appearance, which was typical crown-like appearance. 7 coronaviruses can infect humans. The one that causes SARS emerged in southern China in 2002, quickly spread to 28 other countries. More than 800 people were infected and 774 died. Small outbreak in 2004 involved. Eventually came the MERS, Saudi Arabia, Middle East, where almost 2,500 cases were found, and it was more actually deadly, killing almost 858 people. It has the same respiratory symptom, but the renal involvement was more in this particular virus. Now, when we see the future trajectory of COVID-19, this paper gives us a wonderful insight on that particular part, whereby you can see here they have extensively studied its transmission from human to animal, animals to human. They also saw that what actually happens in the various parts of the body, various parts of the nation or the world, and accordingly it has been decided there are certain key gaps in the developing an effective global response. Now, as far as the epidemiology is concerned, what are the effects of geographical and socioeconomic variations in the vaccine coverage and disease on the ability to convert the pandemic to an endemic or the epidemic disease? What is the contribution of the immunosuppressed population to the rapid evolution of SARS-CoV-2? Virology mechanism of which viruses adopt to different hosts and therefore crossing specific barriers or species barriers. Is viral sequence evolution effectively reduced by vaccination? Is a question mark. Immunology, we know that what are the correlates of protection of vaccines in the natural immunity? Lot said about this herd immunity, the population immunity, or the reproducible immunological assays in the population to follow the disease for its incidence and severity. What is the impact on the antigenic drift? What are the criteria for the renewal or the boosting of vaccines? And what are the roles of mucosal immunity in limiting viral shedding and preventing severe disease? There were certain tools and technologies for the surveillance where the globally accessible diagnostics and deep sequencing tools were established continuously and sustained global surveillance of the disease and variant. The vaccines pan actually the coronaviruses, vaccines and monoclonal antibodies that will address both the SARS-CoV-2 variants and the future introduction of pandemic coronaviruses into the human population. And the therapeutics, next generation therapeutics in the form of cheap oral antiviral agents, long-acting monoclonal antibody prophylaxis for persons not likely to achieve effective vaccination, and addressing inequalities in pandemic healthcare and access worldwide to the most effective vaccines and therapeutics. WHO was a major role player in this particular pandemic, and it always addressed this particular question: where are we now? And that's why when these three groups, the World Health Organization with two other organizations, studied this particular evolution, they also decided to have an overview of this particular pandemic at high level emerging issues. Because as the COVID-19 pandemic evolves, several distinct questions and challenges arise. Those challenges and the questions were put in 5 groups: stage 1, stage 2, stage 3, stage 4, and stage 5. Stage 1 is the unknown virus emerges. The pandemic unfolds second stage. The pandemic accelerates the third stage. A multifaceted pandemic stage 4, and the medical countermeasures accounts for stage 5. Let us have a quick review of all the stages. We know that this is an unusual cluster of several viruses causing pneumonia which were identified in China. Some cases were linked to a seafood market. Some patients died, especially older people and those with the other medical conditions. The new disease is caused by novel coronavirus, a family of viruses known to infect animals and humans, and respiratory disease was ranging from mild to severe disease, which explains why certain individuals were not affected very seriously and why certain of our friends died. At that time, no death related to the COVID-19 is recorded, outside China. When the pandemic unfolds by 12th March 2020, there were almost 1,20,000 cases and over 4,600 deaths. And there, the entire world became very, very actually active as well as bit worried because certain things needed to do something for this coronavirus. And the third, the pandemic as in stage 3 accelerated, there was a lot of measures which were taken, and we realized that virus is wise enough to mutate, to change, to make its variants. And then it was a challenge for the entire world. And you know what are the consequences are. There is sustained transmission in the US and India, a new increase of the cases in Europe, while other countries remain COVID-19 free, for example, New Zealand. And then question came, how actually it is happening, so whether it has any role as far as ethnicity is concerned, and how to go about as far as this multifaceted pandemic is concerned. Now, there were a lot of research which was rolled as far as the vaccine is concerned, and this growing concern about emerging variants. As far there are more than 83 million cases, over 1.8 million deaths because of this particular virus. The number varied from day to day. This could be the figure which we got documented from the literature. It caused a lot of economic impacts as well. More than 4% contribution of GDP in the 2020, 88 to 115 million people living in the extreme poverty due to the crisis, 9% of the global working hours lost in 2020, the equivalent of 225 million full-time jobs. And that's why every individual suffered a lot because of this. We also change a lot as far as the maternal and the fetal health is concerned. We realize that we also need to change. We need to come forward. We need to come out of our offices to cater services to all those unfortunate pregnant women. And we need to do good preparation. There are a lot of things which were there in the preparation, including opening your doors of the car as well, which we adopted to make it a very safe. We were knowing about this surgical safety checklist, but we modified that as a COVID-19 surgical patient checklist with the help of WHO as well as with the help of Lifebox Foundation. And with them, we worked a lot to make certain changes in the COVID-19 patient checklist, where the safety of the healthcare provider as well as the safety of the patient was very well addressed, and who should do what, when it should be done. All those pre-operative, intraoperative, post-operative things were done. Anyone who's interested in knowing about this checklist, please email me so that I can forward this to you, also available on the website. There were certain key safety steps, especially availability of all those protective gears, good communication, which was very important because we know there are nurses, there are attendants, especially in the developing countries, and we need to have a runner nurse playing a major role. Intraoperative also, there were a lot of changes which we realized, and post-operative, again, addressing, briefing, debriefing is again very, very important. And that's how when we work there as a team, we realize we can definitely give services to our patients, the pregnant patients. At the same time, we can attain our safety as well very, very effectively. It has changed our routine clinical practice. We must adopt and accept the new normal. Simulation training important for the staff, which is very important. Debriefing after each case to improve with every case. Still, such small information of putting our mobiles when we are carrying it in a pouch and which we can disinfect also made a major difference. When we worked with this with Royal College of London and Lifebox, we conducted this webinar to train entire world about this surgical safety checklist, which got adopted according to the COVID scenario. And that's how we could do a better for all those unfortunate patients who got COVID disease. I'm very sure this evolution is going to happen in future as well. But as a clinicians, as a medical fraternity, we need to face it because there's no any other answer than facing. Thank you very much, friends. Thank you. Thanks a lot.